have been asked many times to give my opinion about the use of drug therapy when dealing with depression and anxiety, and I have a very definite answer: yes. YES. I am a huge advocate for antidepressant drugs, and I'll tell you, I speak from experience, and I'll tell you a little bit about my story. 40 years ago, I was gang raped at the age of 19 years old. Back then, they didn't have antidepressant drugs, so they weren't offered to me. The only option I had was to take Valium for the anxiety, and of course, Valium is addictive. Now, it wasn't a long-term solution by any means, but I was in therapy on and off for those 40 years. About 10 years ago, in 2010, I believe it was, my family doctor, who was just newly commissioned, because my family doctor for years had retired, and I had gone to a colleague of mine who had her own practice, and she took me on as a patient. When I complained to her about depression, she suggested that I try antidepressant drugs. And she explained that the chemistry in your brain is different when you suffer trauma. You know, it's out of balance, it's out of whack. And what antidepressant drugs do is that they balance the serotonin in your brain, and you're able to function a little bit more normally like other people. So I decided to try it and, see if I could improve the quality of my life. I was put on, I believe, 10 milligrams of Prozac to begin with, and between 2 and 3 weeks later, I could not believe the improvement in my psyche. You know, for years, I had this war going on in my head, and I had like a fog that was engulfing every thought that I had. It was like I was seeing through clouds. I never had a clear picture of what was going on in my life, and that created anxiety in itself. So what happened was this fog had lifted, and I was able to see things differently and more calmly, and I was able to make better decisions. I thought it was a miracle drug. I couldn't believe no one had suggested that I go on it before. Now, back when I was having my children in my younger years, I suffered from postnatal depression to an extreme level that, it actually hindered how I brought up my children. And it was because of their sacrifice. I had to sacrifice them in order to have a decent life. Now, had somebody suggested antidepressant drugs back then, it could have gotten me through that postnatal depression a little bit easier, and it would have improved the quality of my life and the life of my child. So when I look back, I think, wow, I wish I'd known about this back then. It would have saved me years of suffering. So, you know what? Forget what anybody thinks. Antidepressant drugs have a stigma attached to them. Who cares what anybody thinks? What you should be concerned about is the quality of your life and building skills to make your life better on an ongoing basis. So, you know what? Who cares what anybody thinks? Try them. If it doesn't work, you can go off anytime. So 2 thumbs up for antidepressant drugs. Have your doctor monitor you. Educate yourself on the internet about symptoms. I got to tell you, it's a miracle drug. So, good luck, and let's see how your life progresses from here. 2 thumbs up.